Welcome to our channel Students of Homeopathy and let's learn together. So today in this video we will discuss how we can easily select homeopathic medicines for chronic gastrointestinal diseases. In our clinical practice or OPD, we get many patients of chronic gastrointestinal diseases. And we know that homeopathy can provide a very good solution or lasting answer to this type of cases. So, if we can deduce an easier formula or if we can get an easier trick to find out a remedy for the patient suffering from this type of cases, then it will be very helpful for us. And of course, we can save our valuable time too. So, in this video, we will discuss a shortcut formula for easy selection of homeopathic medicines in chronic gastrointestinal cases. So, let's start. But before that, if you have not yet subscribed to our channel Students of Homeopathy, please subscribe it now and also click on the bell icon and select all so that you will not miss any of our informative, educational and interesting videos on homeopathy. The gastrointestinal or GI tract includes structure between the mouth and the anus, forming a continuous passageway that includes the main organs of digestion, namely the esophagus, stomach, small intestine and large intestine. The gastrointestinal tract plus the accessory organs of digestion such as the tongue, salivary glands, pancreas, liver and gallbladder etc. form the complete human digestive system. As per the International Classification of Diseases or ICD-10, the diseases of the digestive system are placed under K group and it includes diseases of the oral cavity, salivary glands and jaws, diseases of esophagus, stomach, duodenum, diseases of the appendix, hernia, non-enteritis and colitis, other diseases of intestines, diseases of peritoneum, diseases of the liver, disorders of gallbladder, biliary tract and pancreas, and other diseases of the digestive system. So, it indicates that there are several diseases which come under the diseases of digestive system or the gastrointestinal diseases. Out of these, let's list out the most common diseases or the diseases mostly we see in our homeopathic clinic or OPD. And these are irritable bowel syndrome, peptic ulcer diseases which included both gastric ulcer and duodenal ulcer, inflammatory bowel diseases including Crohn's disease and ulcerative colitis, polylithiasis, gastroesophageal reflux disease that is GERD, and hemorrhoids that is piles etc. So, these are the diseases, and now if we will consider the common symptoms this patient represents, then the common symptoms of GI diseases are pain in abdomen, nausea and vomiting, irritation or heartburn, abdominal fullness and discomfort, flatulence, diarrhea, constipation and bleeding. So, now we can tell that in regard to GI or digestive system, the diseases are many but the symptoms are limited and which can be an advantage for the homeopathic approach. In homeopathy, we can approach a case in various ways or from different angles. For example, we can approach a case considering the constitution of the patient, causations, keynote or characteristic symptoms, important modalities, miasms, totality of symptoms, and from the name of disease or specifics, etc. But out of these, the best prescription can be the constitutional medicine, which covers the sphere of action of the disease, and here the sphere of action is GI tract or the digestive system. Also, if a medicine is covering the sphere of action, then it almost covers the main presenting complaints of that system. So, let's list out some constitutional or polycrystal medicines which prominently cover GI system or digestive system as their sphere of action. So, the medicines are Nox vomica, calcarea carb, calicarb, carbovage, arsenic album, phosphorus, sulfur, lycopodium, archnitricum, pulsatilla, antimcrute and moxol. These are the medicines, and we have listed out here 12 medicines which have prominent action on the GI system. And all of these are polycrystal or constitutional medicines, means they have prominent mental and physical generals. Then the next question comes, how to differentiate this? I will tell you a simpler trick So, let's consider a very important physical general, that is reaction to heat and cold or RHC. And by considering this, we can categorize the medicines into 3 groups: the chilly medicines, hot medicines and ambithermal medicines. So, out of these 12 medicines, the chilly medicines are Nux vomica, arsenic album, phosphorus, calcareous carb, calicarb and carbovage. The hot medicines are pulsatilla, sulfur, arsenitricum, lycopodium. And in the ambithermal group, we have antium crude and moxal. Then, let's consider another important physical general, that is thirst. In the chilly group, Nux vomica, phosphorus, calcareous carb are the thirsty medicine, whereas arsenic album, carbovage, calicarb are the thirstless medicines. Here I must tell you one thing. We have put arsenic in the thirstless group as we are discussing about chronic cases. And arsenic is thirsty in acute, whereas thirstless in chronic cases. Coming to the hot group, pulsatilla is thirstless, whereas sulfur, arsenitricum, lycopodium are both thirsty or thirstless. And in the ambithermal group, moxal is thirsty, whereas antium crude can be both thirsty and thirstless. Then for further differentiation, let's consider another important characteristics, that are hurried or slow. We can determine the patient is fast or hurried or slow very easily by mere observation during his waiting period while entering to our chamber and during interrogation also. In this regard, you can watch our video Pick the Mind Rubrics Easily, how to pick mind rubrics from mere observation by visiting the link below. So, further, we can differentiate the medicines into hurried or slow categories. Here, the medicines marked in red are the hurried medicines or for the hurried patients. The medicines are Nux vom, phosphorus, arsenic album, sulfur, arsenitricum and moxal. And the medicines marked in the green are the slow medicines. So, the slow medicines are calcareous carb, carbovage, pulsatilla and antium crude. And finally, the medicines marked in yellow, calicarb and lycopodium can be considered for both group of patients. So in this manner, we reach to an individual medicine very easily for the patients of chronic digestive or gastrointestinal disorders. So that's all for this video. We welcome all your feedback and comments. If you have not yet subscribed to our channel Students of Homeopathy, please subscribe it now and also click on the bell icon and select all so that you will not miss any of our informative, educational and interesting videos on homeopathy. Thank you for watching.